So our first question is from Rita in Norton, and she wanted to know your views on Medicaid expansion.
Sure. Well, first of all, Rita in Norton, thank you for your question. And we have been to Norton several times and love Norton, so it's good to know that there's interest there. We very much support Medicaid expansion for both humanitarian and economic reasons. If people don't have access to health care, they wait until it's too late, maybe lose a limb or lose a life. So for that reason alone, we should be expanding Medicaid. The other reason is if you look at what's happening to hospitals around the state, they're struggling to stay open as hospitals have become the bank for the uninsured. And a bank can't stay open if it's not solvent, nor can a hospital. We have sent over $2.7 billion, that's with a B, $1 billion of our own tax money out of state to other states that have expanded Medicaid and yet have refused to do so here. And that's been both the decision of Governor Brownback in the past and now Governor Collier as well. I want to just make a few more comments about that. 60% of community hospitals around the state are having to be supported by local tax to keep their doors open. So 60% of our hospitals receive either local property or sales tax to stay open. At the same time, we're sending our tax money out of state, so that's how crazy it is. And just one last comment about Medicaid and CanCare. It's been privatized. The CEO of United Healthcare, one of the 3 for-profits that run CanCare, his salary is over $66 million, last public salary. That's money that should be in Kansas, not out of state and for profits. It should be supporting hospitals, and it should also be supporting nursing homes, because this goes beyond just hospitals. Because CanCare is either delaying payment or not paying enough, nursing homes are either closing around the state or they're refusing to accept new patients. Many Kansans, to no fault of their own, outlive their resources. So if you're spending $6,000, $7,000, $8,000 a month to stay in a nursing home, no matter how hard you work and how long you save, you run through that quickly. And so these are just some other issues that we have with CanCare and Medicaid and need to be fixed. Rosie, I talked too long. Go ahead.
No, you got it all.